All right, we'll get started in a minute. I'm just letting a few more people enter the Zoom waiting room before we get started. So it's 12 o'clock now, so I'll wait another minute and then I'll start off with our introductions. Only because it's hard for me to talk and manage this panel at the same time. All right, we'll get started in the interest of time. First of all, I want to thank everyone who is in the room. Thank you so much for coming. We have lunch, a really good lunch. So please help yourself. Welcome to International Social Work Day. So we're very happy you could join us for our lunch and watch party. And for those of you who are on Zoom, thank you for coming virtually. I really appreciate it. I know that we have people from the community. We have people from other countries. I'm so glad that you can spend this time with us today. So I'm going to get started. Welcome to today's University of Pittsburgh School of Social Work celebration of World Social Work Day. Today's lecture is funded through the Sidney and Julia Teller Lecture Fund Endowment. So social work is involved in many ways in global spaces. Our responses are often come when there are disasters, when we're helping communities recover, when people are impacted by climate change or by disaster, when people are impacted by war. Social work is in those spaces. However, social work also needs to be there at the table before disasters happen. Let me just remind us all in this room and online of a few of the things we've experienced in the last year. The Canadian wildfires in the province of Quebec, which resulted in health complications for many people, including me, who ended up in the hospital with the first occurrence of asthma since the Richard Nixon administration. The change in the climate certainly affected me. Palestine, Ohio, the train derailment that still continues in the community to keep people from returning home. Hurricane Katrina, which I'm sure that Reggie will talk about. And a dozen hurricanes that we could all mention, one of which impacted my family down in Cape Coral in Fort Myers. The role of social work is more than mitigation. It's also building resilience and being advocates. Climate change impacts humans and animals, disproportionately so for people of color, for children, for elderly, and anyone who lives on the margins economically. This is why today's talk is so critical, and I thank you for being here. Global is local. Global is local. Social justice is climate justice. Social work can no longer be uninvolved in this process. So thank you for coming today. I'm going to read you a little bit about Reggie, and then I'm going to just ask, I'll just have a few logistical things. So Reggie, as I know him, Ferreira, is the director of Tulane's University Disaster Resilience Leadership Academy, executive director of the Consortium of Equitable Disaster Resilience, and he is an associate professor of social work at Tulane University in New Orleans, Louisiana. He received his BSW in social work and a master's degree in disaster risk management at the University of the Free State in Bloemfontein, South Africa, and his PhD in social work from the University of Louisville, Kentucky. He joined Tulane in 2013, where he divides his time among administration, applied and community-based research, engagement program development, and of course, teaching. Currently, he is the chief editor for the American Psychological Association Traumatology Journal, focused on resilient practices among traumatized individuals, families, and communities. He has served on several national advisory committees, including those for the NSA, for FEMA, and for American Red Cross. His main research interest is at the intersection of disaster, climate change, resilience, behavioral health, with work conducted in Europe, Africa, North America, the Caribbean, and South Asia. Over the past 2 decades, he's been involved with several efforts focused on disaster risk reduction and fostering resilience. His projects have been over $43 million in federal and foundation money, and his work, he's published in over 100 journals. So as you can tell, Reggie's a real slacker there. So Dr. Ferreira's work in the classroom has been recognized with several top teaching awards. His engaging, innovative classroom practices, working with both social work and the Graduate School of Public Health. He's also assisting with the development of the DSW degree at Tulane. And he's been working on a launch on the ground and online versions of the MS in Disaster Resilience Leadership Program and dual MSW program. So his work has been most recently figured in popular media outlets such as CNN and the Rolling Stone. Congratulations, Reggie. That's my goal, to make it on the cover of the Rolling Stone. Voice of America, The Atlantic, Fox, ABC, Reuters, USA Today, and Psychology Today. So Reggie loves the outdoors and is originally from South Africa, Bloemfontein. And I just want to thank Reggie for his time today, talking about climate advocacy on this day of social work that we celebrate internationally. A few logistic things. I will advance the slides for Reggie. Because it's easier to manage, if you could hold your questions till the end. Reggie's going to talk for about 60 minutes and maybe a little bit more than that. And then we're going to open it up for questions. Dave and I will monitor the chat, and you can raise your hands for questions. Also, if you have questions, you can email them to me after this presentation, mar104@pitt.edu, and I'll be sure to share them with Reggie. One last logistic thing, if you could please mute your microphones, that would be awesome, so that we can focus on Reggie's talk. And also, if you could, if you don't mind, if you would prefer to go off camera, we are recording, that would be great as well. So with that, I'm going to get started. Reggie, take it away.
Thank you, Mary. And first of all, everyone, happy World Social Work Day, and also, excuse me, happy spring for our friends in the Northern Hemisphere, and happy autumn in the Southern Hemisphere. First off, thank you to Dean Farmer for the opportunity today, and the Teller Endowment as well. Thank you to Mary as well. You know, I was very excited when Mary reached out to me, you know, for this opportunity, because we really need to talk more about climate adaptation within the context of social work, and what we can do on our end, you know, to make communities more resilient towards climate and other shocks and stressors. To the faculty of Pittsburgh, thank you, staff, students, and other guests joining as well. I heard we have some international guests joining us as well. And then for me, it's also full circle today. Two of my mentors and actually former deans, Dean Terry Singer and Dean Ron Marks, are actually graduates from the University of Pittsburgh School of Social Work. So a little bit of full circle there. Next slide, please, Mary. So folks, I promise today is not going to be death by PowerPoint. I am going to cover a lot. But, you know, there is a lot to cover in general in this field. I'm going to take you all on a little bit of a journey, sort of my background, that you can understand my positionality and where I'm coming from. And, you know, the intersection of disaster management, risk reduction, and social work. Yeah, and then we're going to be talking about some solutions in general. My TV is on Sky News every morning, and this morning, that interview with a gentleman from the UK who actually works for the World Meteorological Organization. And, you know, it was, again, just the same message, you know, of how grim things are. You know, 2023 was the hottest year on record. You know, records were shattered. It wasn't even marginal changes. Records were shattered across the board, across the globe. You know, and we need to do more. But But, we're also at a stage where, there's been a lot of talk. I'm so tired when I go to these larger scale conferences, it's constant talk, but is there actual action? And that's where social work is really positioned fairly well, to work with the community, and, to assist the community and partner with the community to make the world a better place. If we have to wait for politicians for things to get done, nothing will get done at the end of the day. I'm going to be sharing where do I start in general, with this type of work. You might be new to the field, so I might share some nuggets of how I actually got involved and what you can do. I'm going to be sharing two of my projects that I'm currently busy with. 1 year in the Gulf South, where we work with grassroots organizations that are either BIPOC-led or BIPOC serving, working to address climate change and increase resilience. And then I'll share some findings from a recently completed project in my neck of the woods regional area of South Africa, where we looked at equitable resilience from a global South perspective. And, then hopefully there will be some opportunity for questions and discussion. Next slide, please. So yeah, in general, like I mentioned, I promise this won't be death by PowerPoint. I'll give a 10,000-foot view in general of climate related work and climate justice within the context of social work. And, hopefully I can share some best practices for engaging with communities in a local to global lens and how important that is. Oftentimes, we sort of disregard what's happening outside of the US, and that's very important. I'm still shocked sometimes, when you mention the Sustainable Development Goals stateside, and people are like, what's that? It's been around for almost 50 years. There's been different iterations, but I'll be touching base on that as well today. And then lastly, we'll look at eliminating barriers as well. There's resources available, but oftentimes, due to several reasons, communities are not actually able to access these resources to adapt to the changing climate. Next. And then obviously, we'll learn how to make a difference from a social work perspective. There is no other profession that's better situated than social work to bring about change. We understand, I believe we understand communities. We are able to work with communities, households and individuals. It's really a systems approach. And that, again, makes social work really well suited. And then lastly, hopefully we can just celebrate World Social Work Day today and really advocate for social work to have a seat at the table when it comes to disaster risk reduction and climate justice. Next, please. So a little bit about me. I'm a third-generation social worker. The apple didn't fall far from the tree. In several instances, my mom just retired as a dean at the School of Social Work in South Africa, with sort of an emphasis on trauma and resilience. With her work, I've always been very interested in that type of work. And yeah, here I am today. So I'm South African, half South African, half Namibian American by choice. I grew up on a farm setting, so pretty close to nature in general. My grandpa raised me with the notion of, from the ant to the king, everyone needs respect, and that includes nature as well. We sometimes have a humanistic approach to things, so it's important that we look at the environment as well. My background, as Mary mentioned, is in social work and disaster management. It's a quite unique blend, and I've really been enjoying what I've been doing. And again, we as social workers really well suited to be trailblazers, and bringing about real change for communities, households, and individuals. From a very early age, I wanted to work either for UNICEF or the WWF. And, actually a couple of years ago, I was able to work on a UNICEF project working with traumatized children in Rwanda. So that was also full circle for me. With my training in South Africa and where I felt like where I would be able to have the biggest impact was really from a macro standpoint. In the global South, macro social work is really very effective because oftentimes communities are under-resourced. So that's sort of my approach I'm coming from, is really the macro side of things. That doesn't mean micro is not important. Micro is just as important, but I have a preference for macro social work. My master's thesis and my PhD dissertation focus on social vulnerability within the context of Hurricane Katrina. So that's sort of my training, from academic standpoint is really like looking at who's the most vulnerable, who's under-resourced, and who can we really assist and provide solutions with, to increase their resilience and address their vulnerability. Next, please. My work is a blend of domestic and global work. Again, you can't separate the two. You basically need a blend of the two when you do this type of work. When you look at your policies, your local policies, your national and your international policies, there needs to be some intersection between those. Next, please. And then obviously local to global is very important with the work we do. So there are different definitions out there. In general, I just went with the UNDP's most recent definition for climate justice, and it's a pretty straightforward one. It means putting equity and human rights at the core of decision-making and action on climate change. This really resonates with me as a definition, is really putting equity first for all, that we can really have action on climate change. And then another definition from the University of California Center for Climate Justice, that we recognize the disproportionate impacts of climate change on low-income communities and communities of color around the world, the people and places least responsible for the problem. And that is really important, that we start and take ownership there when it comes to climate justice. Another aspect that's very important in terms of definition, if we really look at disaster as a context or as a concept, it's only really a disaster when the human element is involved. I know that's a very humanistic approach, but who better than social workers to work with in the disaster context? It's a definition that's been around in the UN's definition, American Red Cross, all of them basically stresses that the human element needs to be involved. And again, social work is on the forefront in that regard. It's also important that we look at vulnerable populations within this context. So I'm not really covering socially vulnerable populations today, but look at the work of Wisner and Dr. Susan Cutter that really gives a great explanation of who's the most susceptible to disaster in general and who needs resources when under stress. So yeah, transitioning to the Sustainable Development Goals, like I mentioned, they've been around for a while. The newest iteration is really focused on the 2030 Agenda for Sustainable Development when it came about. And all the member nations of the UN signed off on this. And it's really, where we strive to end all forms of poverty, address inequities, ensuring that we get equity on the table, tackle climate change head on. Effectively, we have only 6 years left. And unfortunately, the COVID-19 pandemic and some of the more recent conflicts have really taken away attention from this. Not that I'm not saying those events weren't important or currently important to get attention, but we've sort of pivoted away from the SDGs. And, we really need to do a better job, especially as educators, for those of you who are social work educators, to really stress the importance of the SDGs across the board. Next slide, please. So in terms of the SDGs, some of you might have seen this graph before. They're all cross-cutting. There's a lot of work that went into prioritizing these 17 different components. They're all interlinked. Of course, they're very relevant to social work and basically forms part of our daily practice or our research. So again, that's where social work really aligns well with the Sustainable Development Goals, this field of research, this field of inquiry in general. Like I mentioned, we do really need a bigger push to advocate for these different components within the field, within our daily practice. And, purely just from a practice standpoint, you can't separate them from one another, and they sort of interplay with each other. I don't have a favorite year, but, really the climate action one is where I try and focus a lot of my work, and also sustainable cities and communities. But we need to ensure that when we put forward these agendas, that they're accessible and that they're equitable as well. Too often we have a top-down approach to a lot of these initiatives, and then there's not buy-in from the community in general. And then that's why a lot of these things just sort of fizzle out at the end of the day, because the community is not able to take ownership of what they're participating in. Next slide, please, Mary. And something that's also very important to me in my work, and hopefully you will start incorporating it into your work as well, is the Sendai framework for action. It builds on the IOGO framework. There's 7 targets for disaster risk reduction, where there's several initiatives to reduce mortality, people being impacted by disaster, the economic impact of disaster. Oftentimes when there's disaster, there's almost like a vicious cycle that happens, especially from an economic standpoint, for communities, households, and individuals. Then there's obviously some initiatives that they're trying to increase, with disaster risk reduction strategies, and then these strategies flow into priorities for action. Again, I don't want to bore you all with policy, but I do recommend look into these and see how you can incorporate it into either your research or teaching or your daily practice as it relates to disaster risk reduction. And the idea here is really that we increase resilience, especially for the most vulnerable, and of course also adapt to some of the stressors we're experiencing. Next slide, please, Mary. So where do I start? Obviously it's overwhelming, constantly in the media, and we're experiencing it ourselves as well. I mean, just in New Orleans last year in the summer, we had the second longest heat wave in the world. I mean, these things do impact you, especially our mental health. And if you're trying to help here, where do you actually start? So it can be difficult to determine where to start, but I do have some starting points that I recommend that could be applicable for you. Next, Mary, please. Very important, meet the community where they are. Too often, we parachute into communities and have imperialistic ways of telling communities what they should do instead of asking them what they want and need. So it's very important that we meet them where they are. But this is not something that's just going to happen overnight. It takes patience. It takes trust building. There's a huge trust deficit, and I'll be talking a little bit more about trust deficit. Where communities have been burned time after time, with initiatives. And again, just imperialistic ways of doing things, where communities at the end of the day, it's not that they don't want to work with you, but there's distrust. You have to understand multiple languages, and I'm not saying actual languages, but you have to understand federal language, national language, terminologies that are being used. And unfortunately, social work sometimes tend to silo themselves, so it's really important that we make an effort to understand what our urban planners are talking about, to understand what our engineers are talking about, our emergency managers, that we can be part of the conversation at the end of the day. I've mentioned imperialism a little bit already, but that's very important and should really be on the forefront. Disaster capitalism as well. The disaster response and recovery industry has become a multi-trillion-dollar industry around the globe. And oftentimes the community doesn't have access to these resources, so we have to start and address disaster capitalism as well. Something that's of real importance, and really if you're trying to know where you can start working with a community instead of just having a band-aid, because that happens so oftentimes with disaster response and recovery, we throw resources at a temporary has caused the problem at hand. Then very important that we understand the historical context of a community. Again, we just can't mission into a community and think, we have like a savior complex and want to try and help. That's not wrong, trying to help, but you have to understand historical context, because folks could have been burnt in the past, for instance. Next, please. So one thing I want to share with you all is the pressure and release model, just to provide a context if you approach a community that you can understand how things came about, why the community is in a vulnerable situation. So on the one end of the model, you have a vulnerable situation. Then on the other side of the model, you have your hazard. And if these two come into contact, you usually have a pretty epic proportion disaster. So Mary, if you can maybe just click there for us a couple of times, it's the image that's going to pop up. So on the right-hand side, we have our hazard. On the left-hand side, we have our vulnerable situation. And then we have our disaster and climate impact. If you are very vulnerable on the left-hand side, the vulnerable situation, you have a hazard that's pretty intense. If these two come into contact, you're going to have a pretty bad disaster. So like what happened with Katrina, Hurricane Katrina, we have a very vulnerable population here in Southeast Louisiana to start out with. And, Katrina was also very impactful or intense. And when they came together, you have these large scale disasters that do occur. When you have a very vulnerable population in general, we need to make sure that we build in measures to increase their resilience, that then we can avoid, when hazards do happen, that we can lessen the impact of the disaster per se. So here's sorry, Mary, can you just go back, the progression of vulnerability model. And this has been around since the 1970s, but it's really a great model that can lay out how things actually comes about, and sort of the starting point of how we can go about addressing vulnerability, but also increasing resilience for communities. So our first column on the left-hand side is our root causes. So this is things that happened either through a political ideology or system that could have happened over hundreds of years, or a system that's marginalizing certain populations. This then leads into our dynamic pressures where, we have a lack of institutions that can actually ensure that populations are resilient in the face of stressors. You have also macro forces that comes about, where you have urbanization, there's no more resources in rural areas. So you have an influx of people into larger centers. You have deforestation taking place, and there's like overgrazing, especially in our developing countries that happen. And that then leads to unsafe conditions for populations in general, where livelihoods become at risk. We have lower income levels in general as a result of the root causes and dynamic pressures. And then at the end of the day, there's just our populations tend to settle in very high risk areas. Then on the right-hand side, we have our hazards. And then when these two come together, like I mentioned, we have a disaster that occurs. But again, if you're very vulnerable on the left-hand side, and if you're on the right-hand side, you have a very high intense hazard, then you're going to have a pretty big disaster that occurs. So we really ideally want to try and address what's happening on the left-hand side before it happens. Then on the right-hand side as well, we want to build in climate adaptation measures to really lessen the impact when these two entities come into contact. Next, please. So next, I'm going to be talking about the Consortium for Equitable Disaster Resilience. And this actually came about when we experienced Hurricane Ida in 2021. It was a pretty intense hurricane we experienced here in the Gulf South. At that stage, I think it was like number 7 or number 8 over a 2-year span of hurricanes that we had. We had over 20 tropical storms or hurricanes over a 3-year period in Louisiana. And all of this also during the COVID-19 pandemic. From our end, we were approached by the Walmart Foundation, and we were tasked to come up with what are the barriers to equitable disaster recovery. I created the consortium, and we worked with grassroots organizations that are either BIPOC-led or BIPOC-serving, and ensuring they have the tools and mechanisms to actually access resources. Annually in the US, there are up to $2 billion available for communities, but communities don't know how to access these funds or mechanisms or resources. So that's what we've tried to do here with the Consortium for Equitable Disaster Resilience, is really come up with ways for communities have a slice of the cake, if I can be that simplistic, you know, and really have a seat at the table. Next slide, please. So with our work, what we've done was we did an extensive review of the literature the past 25 years as to what are the barriers for communities within the context. And it was a global, so it's not just US, it's a global study that we did where we reviewed the literature, and we ended up identifying 29 barriers that communities experience in accessing resources as it relates to disaster recovery or climate adaptation mitigation. We use that information to then create an equitable application portal for grassroots organizations. We reviewed over 30 philanthropic websites and used our literature review to create an application portal. Through that application portal, then we reached out to over 500 grassroots organizations that were impacted by Hurricane Ida. We ended up selecting 8 grassroots organizations that formed part of a fellowship. We did some re-granting, and each organization had the ability to basically take their application that they did with us and build out a larger application for funding, but also within their context of work. So we had folks who worked in rebuilding. We lost a lot of houses. During Hurricane Ida, there were some folks working on coastal restoration, and then also within the mental health space, where we actually had a group of 4 social workers that participated in our fellowship. We also trained the next generation, which is very important in ensuring, you know, that we have folks who can carry forward the work and also be specific in terms of like advocating for communities. And then one of our legacy products that we're leaving with this is a resilience hub that you can access through our website. Next slide, please, Mary. So our report will be released early next week. This is actually from the report, and I apologize for all the narrative. But from our work, we identified 29 barriers that communities face in terms of accessing resources. We had 5 main themes that came about, and you know, our themes are listed here. But you know, our first one is just confusion in general, you know, with the recovery process and difficulty in navigating it. Yeah, then we have our exclusion, you know, in terms of political power and recovery as it relates to the decision-making processes. You all would be shocked if you are on the front lines and you hear some of the things communities experience, where emergency managers or local officials don't want to push forward grant applications because of historical racism, and we need to address this. We're in 2024. We cannot just look away anymore. There's exclusion due to discrimination that sort of links up with the previous one that I had mentioned. And then our politicians just should do a better job in general. One of the issues we have, especially in the US, you know, a lot of politicians are only around for certain terms. So they're pushing their own agendas and not the agenda of the community, unfortunately. So yeah, we need to ensure that we vote and advocate for communities as well, that they're able to push forward their needs. And then a huge issue in general, and sort of our continuing work is going to be focusing on the funding aid ecosystem that is just so cumbersome and labor intensive for communities to apply for grants, to access resources. So yeah, we list some elements there, and I'm happy to share the report with Mary, and she can share it with you all once it's available next week. But you know, just some things in general, and this is not rocket science. You know, I mean, lack of staff diversity, you know, exclusion of renters, you know, so again, looking at our most socially vulnerable, staff morale, again, you know, we're seeing revolving door, you know, there's so many disasters and folks are generally tired, you know. We had COVID, and then on top of COVID, you know, we've had a spate of disasters. So I do think people are a little bit battle fatigued in general. So these are some of the barriers we identified. Then we've come up with a set of recommendations, and we actually recently presented it to a subcommittee of Congress that can push forward, you know, especially with some of the federal programming that's happening within the climate space. Next slide, please, Mary. So some of our recommendations, and these are very, very core to social work. That's why I get very excited with them. Everyone should have a voice. As social workers, we advocate for the voiceless. So we definitely need to make sure that our communities have a voice at the table. It's very important, that the injustices that has happened, that the perpetrators actually come to the table. That we have a form of reconciliation that can take place, especially, when it comes to environmental injustices. Just in Louisiana alone, at one stage during the COVID pandemic, we had the highest mortality rate along Cancer Alley. So for those of you who are not familiar with Cancer Alley, it's along the Mississippi River, but New Orleans and Baton Rouge, you have all these petrochemical plants, and that's really impacting the communities. And they tend to be communities of color, so we really need to do a job where we can advocate for these communities to have better living conditions, but also to take these big oil companies and other companies head on and demand, that they're responsible for what they're doing. We need to believe in the transformative and adaptive capacity of communities. Too often, especially coming in, we have our biases. And again, that's where imperialism comes in, where we think communities are helpless. Communities are not helpless. Communities know the way. So again, it's providing them with the needed tools or access, or collaborate with them that they're able to access these resources. It's very important, that there's equal access to programs. One of the things we're researching is, like, let's say I'm impacted by disaster and Mary is impacted. Mary might need 5 resources to recover from the disaster, but I might need 8 resources. So how do we go about this instead of just in general, like person A gets $500 recovery funding, person B gets $500 recovery funding. So we really need to rethink and reshape disaster assistance programs in general, because we are just going to see more disasters. It's not going to go away. And then also equity in our programs, ensuring, again, like sort of what I touched base on just now, that there's equity. A lot of programs think there's equity, but, they haven't really asked the community what their needs are. So it's important that we take an equity lens to what we're doing and actually have conversations surrounding equity, that the community have a voice at the table. Next slide, please. With our decision making, it's very important that we include historically marginalized throughout this recovery process. I've been in so many town hall meetings, where meetings are scheduled during the day when community members work 2 or 3 jobs. They're actually not able to attend. There's childcare struggles or barriers for them. So we need to make sure that the communities that are impacted the most do have a seat around the table. They're also able to voice their concerns. And once these concerns are voiced, there's actual action, not just listening, that we have action to the process in general. It's very important that we start incorporating disaster risk reduction, climate adaptation approaches into our school curriculum. And I'm talking from K through 12, undergraduate, our graduate degrees, that we really, and even in the workplace, that we create a disaster subculture in general, that we're able to adapt to what we're facing with disasters. And then lastly, it's important that communities feel valued with what they can bring to the table and not disregard them. And again, the imperialism, I know I sound like a broken record bringing up the imperialism, but it's very important, especially in the disaster recovery space, that we take these measures and then also respect communities. I'm oftentimes just shocked when I hear how planners are talking about, people need to relocate, they need to relocate. An example with Hurricane Ida here in Louisiana, there was over 2,000 Section 8 vouchers that was handed out to households to basically relocate from the community. 97% of the community refused them because they want to stay, because they are rooted here. They're rooted to the soil. I mean, there's this whole notion, and nothing against Michigan or the northern states. You can't expect a whole city or a whole state to relocate there. Maybe one day in a perfect world we can do that. Other conversations I've heard, a city like Mumbai, India needs to relocate because they're at complete risk. That's just not going to happen. So we have to come with measures where we really value the community's input and work with them, that they're able to adapt with what's happening and what they're faced with. And then lastly, as social workers, we need to ensure that we advocate for the most socially vulnerable. We tend to know who the community members are, and the community also knows who's the most vulnerable. That we get resources to them in blue sky days. So blue sky days is when we don't have disasters, that we ensure that they're actually able to access these resources that will make them more resilient in the face of disaster or climate impacts. Next slide, please, Mary. So now moving a little bit more towards the global south. So like I mentioned, I've been part of a project in my native South Africa where Global Resilience Partnership received funding from the Swedish government and actually created this cohort of 8 working groups focused on building equitable resilience in Southern Africa through the Southern African Resilience Academy. And there was 8 different groups working. Our group specifically looked at equitable ways of ensuring communities foster climate adaptation. Yeah, this was a great experience, and really also like how the global south knows what's best for them. And really putting this on the forefront at the end of the day. The global north, us here in the north tend to tell the global south, what they should do. And it's just a great experience in general. Next slide, please, Mary. So we had a team of Southern Africans from SADC, the Southern African Development Community, participate in this study or project. We had 2 parallel research projects. The first was a group concept mapping where we asked researchers and practitioners, and there was actually several social workers that participated in our study. How do they perceive equitable resilience, disaster resilience in their community? So what's sort of the components of this in their community? And then we also had a photo voice project with undergraduate students at the University of the Western Cape, psychology students that are from historically marginalized, previously disadvantaged communities. And they were able, through their photo voice, to share their experience of what they perceive as equitable resilience. And happy to share that document with you all as well. Next slide, please. So this is what we came up with our group concept mapping. So those of you who are not familiar with group concept mapping, it's a multi-scale dimensional development tool, but it's mixed methods. So our prompt was, how do you perceive equitable resilience in your community? We took the prompts, we cleaned them as a team. We provided folks with an opportunity to sort these prompts and then rate the prompts. And the software program provided us with these 9 clusters. And the 2 clusters that really stood out from our participants as what they perceive, what is needed to be, to achieve equitable resilience, was really the social justice approaches. That was sort of the main theme that came through from our folks from the global south. The same with the development aspect as well. The importance of developing and building out climate change adaptation strategies for communities is so needed. Yeah, we have the top down and the bottom up, and so the bottom up is numbers 2 to number 7, which is really community driven, and then we are dependent on the top down aspect, from governments in general, to push forward disaster management and climate adaptation strategies. So yeah, and happy to talk more about this. This paper is currently under review, so happy to share that also when it becomes available. But yeah, it was just important that we provide the global south with a voice. That's probably one of the most important things. And communities know best at the end of the day. Next slide, please. Okay, so what can you do? You can be part of the change needed. It sounds simplistic, but you can really be part of the change, even if it's just advocating. If you walk away today, you're with one thing, and I would highly encourage you, just one thing you're going to do different today going forward. It really does take a village. And again, if we have to wait for governments and politicians to bring about decisions, we're going to wait forever. Again, policy is important, but we have to start with action, like from the bottom up with what we're doing. And especially for those who are working on the frontline communities, working with your communities, advocate, talk about climate adaptation. We have to anticipate disaster is not going to go away. We are going to see more disasters. It's not doom and gloom, and it's not a prophecy. I mean, we're just going to have to adapt and anticipate as well that disasters are going to happen more frequently, and the impacts of climate as well, that we're able to adapt accordingly. Next, please. Start with volunteering today. There are several organizations that actually focus on climate adaptation. If we Google search, and I'm sure you'll be able to find who's active in your community. But yeah, again, you can start by just being an advocate in general and talking about this. Next, please. Impact for those, advocate for those impacted most is also very important. And I've spoken about this throughout today, but it's very important that we put it on the forefront of several agendas, especially the global north. The global north is responsible for a lot of what the global south is experiencing, with our carbon emissions. And, the most vulnerable, and especially our developing countries, are bearing the brunt, for what we're doing. So we really need to try and minimize our carbon footprint. Next, please. Focus on adaptation. What can you do, in terms of whether it's intangible or tangible? Intangible can just be like it doesn't mean you have to feel like you've been defeated, but sort of anticipate that there's going to be disaster. And then how can you prepare for it? And also, like I mentioned, with these reports constantly coming out and the negativity, it's like, yeah, we know this, but what can you do yourself, even just for your own household or for your community? How can you adapt and address the changes that we're going to be facing? Next, please. Reduce, reuse, recycle, limit your footprint as best as you can. Really important that we push forward with this. I sometimes hear some folks say, like, yeah, by reducing straws, it's not going to bring about change. Not so much about reducing straws, the plastic straws. It's the whole concept of just reduce your use in general. Switch off a light. I mean, it might not sound like making a big difference, but, every little drop in the bucket will help at the end of the day. Next, please. Very important, and like I stressed throughout, it's be an advocate for both local, national, international policies, especially the international policies. If you're US-based, really advocate for the Sustainable Development Goals. Really advocate for the Sendai framework for disaster risk reduction. Advocate, but also educate people, and have an open conversation of the importance. I mean, all member states of the UN signed off on this, and last time I checked, the US is a member state. So it's important that we push this narrative and agenda forward, that we can just make the world a better place and a more equitable place. And then probably my biggest takeaway for you today is really, make self-care a priority. There is doom and gloom, with what we're doing. And there's a lot of concepts coming out as it relates to climate change and mental health, with climate anxiety, solastalgia. But, find ways how you can build in positive change for yourself and for your household, especially if there's younger kids around. That you take care of yourself, because if you can't take care of yourself, you're not going to be able to take care of others at the end of the day. Next one, please. And that's it. My biggest takeaway is just be a voice for communities. It's very important. We need to address the imperialistic way. We keep on talking about these things. But, really now is the time for us to bring about significant change. And it starts with you today. And remember, the community knows what's best for them. Best interest of the community is really a takeaway here. So I want to thank you all. I know it was a lot that I covered. And Mary, I apologize. I'm done a little bit earlier. But yeah, there is a lot to be done. But you can bring about change today. But, enjoy spring, enjoy World Social Work Day. but take the measures that you are able to be prepared for disaster and adapt for our changing climate. Yeah, I want to thank you all, and yeah, now time for questions and discussion.
Yes. All right.
You need a microphone.
It's in there. It should be powerful. Yeah.
Okay. Reggie, can you hear me?
Yes, I can.
All right. So it's Mary again. How do you say thank you in Afrikaans? Was that
Yeah, buy a donkey, and in Sesotho, one of the native languages where I grew up, it's Kialabua.
right? So are there questions in the group? Oh, about anything that Reggie's talked about, questions or thinking about here in Pittsburgh and Allegheny County, some of the climate changes we've experienced here. Some of the people on, Dave is going to check the chat, and he's going to check if there are questions being raised.
No questions yet.
No questions yet. Okay, so I do have a question for you, Reggie. As you've worked with people across disciplines, right? One of the things that I sometimes experience in teaching global perspectives of social work to undergraduates, they come from all over the university, from health sciences and as well as social work and psychology, gender. Some engineering students periodically will wander in the class. I find students actually have a hard time talking across the disciplines. The social workers worry about not understanding science, and the engineers feel uncomfortable sometimes, or the more STEM students about sort of although they are a social work minor, so they're not that uncomfortable. But so how in the real world, how do we address that?
That's a great question, Marion. I mean, I've been fortunate. I've been exposed to interdisciplinary work for a while now. But, I do think probably understanding the different terminologies that we can all understand where we're coming from, and then working towards a common goal. If we have a common goal in mind, I think it makes it much easier to understand where our colleagues or peers are coming from. That's probably what I would suggest and what I've been doing in the past. But then also to stress the value that so let's talk about social work. What's the value social work is bringing to the table at the end of the day? That's probably one of the most important things. And it's not to be pompous or arrogant, but, we are really well suited to work in this field. Yeah, I mean, when people ask me social work and disaster, it's like, yeah, if you look at the definition, it's only a disaster when the human element is involved. So yeah.
Thanks. There was a question, a couple questions in the chat.
In the chat.
Do you want to say anything about it?
Yeah, do you want to, I'll bring it over here so you can read it on.
So, Joaquin has a question in the chat. Thank you, Joaquin. How do you prevent that education and disaster resilience to not add a stress on facing the future? So I think that's and that's also something that I experience in my students, this sense of, we're already facing a lot of student debt. Please don't pile climate change on us as well. So how do you prevent, this idea that we're not stressing on facing the future, but how do you really move into that adaptation?
That's a really great question. I don't think I have a clear-cut answer. That's why I sort of ended on the self-care aspect. And just finding a balance and just knowing when to step away from social media, stepping away from the media in general. It's important, just finding that balance. At the end of the day, also, I see with my own students with our master's degree in disaster resilience, and then the social work students, and the social work end, there's a lot of stressful things they're working with. And then you add on the disaster piece, But at the end of the day, we choose this profession, or the profession chooses us. So it's really just finding ways to build in the self-care. I don't know if that answers the question, but that's sort of the way I go about it. I mean, what we're seeing is facts. I mean, the facts are not going to go away, but it's also like coming up with solutions. I know my fellow South African Elon Musk is very polarizing, and I'll leave it at that. But, it's like he said, identify the issues you have and come up with solutions to make the world a better place. I'm sure there's other agendas associated with that statement, but that's sort of the approach I take. It's like, so yes, we know this is the problem, but what solutions can we come up with making the world a better place? And I don't know if it then creates altruism or, you're sussing your own ego, but at least, I think taking a positive deviance lens to things is very important. That's something we found now with our work as well on the barriers piece. There's such a limited positive deviance lens taken with a lot of things we're doing. So it's important that we really push that sort of approach, like self-care and then just having a positive approach. But that doesn't mean we need to disregard the deficits or the vulnerabilities.
Okay, thanks. Jen Russo, hi Jen, wrote, when you presented to Congress, what kinds of questions did they have? And did they think the root causes were actionable?
That's a great question. We actually had very limited responses. We just had a lot of heads nodding with this particular subcommittee. They wanted to know what they can do better, which was exciting in general, so yeah, but it was none of what you ask here in general, which was not surprising in general, because and I've got no issue with politicians. They're important. We need them. But our biggest issue is politicians are only term appointed, and yes, that's important because we don't want people forever around, but they've got their own agendas and narratives. That's why the community really needs to push and keep our leaders more accountable. Yeah. But to your question, the root causes, we mentioned these things, systemic racism, redlining, all of these aspects. We bring that to the forefront. FEMA was created for the white American middle class. Wasn't when it was developed, it wasn't created with in mind of our historically marginalized populations. Yes, FEMA has taken great strides to improve and be more community focused and more equitable, but that's how it came about. So that's really important to understand your historical context, that you know what you're working with.
Jen's comment that it was rather disappointing that our elected officials were not more forthcoming with that. Questions? Oh, there's one in the back.
Well, I wonder if you can share a few examples of principles you discussed here, put into action to address a particular disaster, and talk about the results. Were they able to help the people who you were trying to help?
I only heard half of that, Mary.
Okay. So I think was the question, make sure I got this as well, was that could you talk about a specific disaster using the model that you spoke of and sort of the outcome of those efforts?
So the progression of vulnerability model. We did work in Nepal, for instance, right after the earthquake, and I used the model just before we went in, and we met actually with a lot of high-level government officials, and the model really sort of elucidated, what the situation at play is. One of the main issues we experienced was that at that stage, there is 16 shared government. So it's that political ideology that came about, and now that hampers things of getting done. And then again, that impacts the community. I also used the model actually with my dissertation, where I looked at social vulnerability pre-Katrina, post-Katrina. And the model was just great and really sort of underlining some of the issues that's been happening for hundreds of years, just with imperialism, capitalism, and also like just our most vulnerable communities being shunned away from resources. And we found that this now with our work again that we recently did. So I don't know if that answers your question.
Well, the most recent hurricane, Hurricane Ida in the Gulf, were you, excuse me, were you able with your team to go in and work on that, sort of reduce the risks and sort of build or adapt for future hurricanes, which will come?
Yes, I believe through our fellowship, where we worked with 8 grassroots orgs that are either BIPOC-led or BIPOC serving, through our collaboration and them working with us, and we're working with them, I think we were able to come up with just making a paradigm shift, of them being able to access resources, also build out preparedness. One of our groups, actually, Ubuntu Village, they work with at-risk youth that has actually clashed with law, and they created a disaster preparedness program for the youth and their parents. So it's again, the community knows. The community just sometimes need a little push or the resources or the advocacy to really bring about the change.
Lucas has his hand up.
Oh, Lucas,
Yes.
go ahead.
Thank you. Thank you very much. Thank you very much, Reggie, for this lecture. It was really a systematic one for me. I learned really a lot. I'm from Wrocław University of Science and Technology, Poland, and I'm an urban planner. So I was really, really curious listening to your lecture, especially when you pointed that in some regions of the world we have problems with urban planning because we need to relocate people. We need to rebuild the settlement structures because of the climate change, for example. However, my question is more about the role of urban planners in disaster management, in some kind of social learning that you take during such situations. Because what I observe in urban planning, what has been happening since 1990s, is a kind of shift from top-down approach to bottom-up approach. Yes. And there are more and more urban planners who are really aware of what is going on in the communities, and who want to involve communities and take them to the table and give them voice, give them a say. But my question is, can you see any room for some kind of strategic thinking? Because my impression is that you focus really on managing the situation. I mean, we have a disaster, we have to cope with this, and then we will have another one probably next year or within the next decade. But is there a room for a strategic thinking in terms of planning, in terms of building a long-term policies? How would you react to this?
Thank you, Lucas, and a great question. And my PhD actually had a huge urban planning element to it. My research assistantship was in the School of Urban Planning at the University of Louisville. So really appreciate our urban planners. To your question, I think it's being proactive. Too often, we wait for a disaster to happen. I mean, it's going to happen. It's inevitable that a disaster is going to happen, whether it's a climate-induced event or climate is going to impact us some way, shape, or form. We need to anticipate and plan accordingly. So I don't know if that answers your question, because oftentimes we wait for something to happen, and then it's almost like a knee-jerk reaction. And people have great intentions, but oftentimes then that's when communities really get burned and trust is broken with communities. So, that's where just collaboration is best, but it's also taking, again, the community voice, bringing it to the table, ensuring, if there's community events or including the community in the planning process, that it's accessible, it's scheduled at times, it's not going to be a burden for the community. I mentioned the childcare aspect. If you do have a community event, have the opportunity for childcare to be available, just make it easy for the community. Don't add on an extra layer of burden. But it's, again, this whole aspect of anticipate we're going to see something and plan accordingly. I'd also understanding what the risks are in your community. If you can identify the risk and apply measures to address the risk. I think that's already, from a planning standpoint, from a preparedness planning point, one of the best ways to go about things.
Yeah, of course, and I also appreciate your approach to communication, because you said we are speaking different languages, and urban planning also has its own language, and therefore I think we should really try, or make some effort to understand the communities, and the communities should also try to understand urban planning approach, because it's really important. In a wider scale, if you want to manage climate change, then you need to look at the whole, like, urban area or city. So we need to communicate. I think that's the key.
Definitely. I couldn't agree more. I was at the United Nations University in Bonn in 2009, and our introductory class was on definitions. And at that stage in 2009, there was over 72 definitions for disaster. So we have to come up with universal definitions, and then we can work from that, because at the end of the day, this whole approach of addressing climate and disaster, a multidisciplinary approach is needed, transdisciplinary approach is needed. So, yeah.
Yes, thank you very much.
Thank you, Lucas.
Okay, I think we have time for one more question, which is a comment. It's a great one from Ed. Ed said that there are promising practices that help promote developmentally appropriate climate preparedness in the early childhood spaces, which I did not know it, that center Black belonging and resilience, especially through children's storybooks, picture books, etc., and that help to build self-efficacy. And that is, I did not know that, Ed, so thank you. So there are some efforts to do this at the early childhood level.
Yeah, thank you, Ed. Couldn't agree more. There's been a lot of research that went into the backpack program sort of approach. So sharing information with kids, and then the kids share it with their parents. A lot of preparedness programs have actually been built around that sort of modality of doing classroom with especially elementary kids, and them taking the information to their parents. But that's very exciting to hear what you're sharing here.
Yeah, and actually, Ed put in the chat a URL for the unconference, Black Rep for Kids. So that's awesome. Thank you, Ed, for doing that. This idea of, children learning the language, talking to their families about it and it's really powerful. And I thank you for bringing that up for us and letting us know about this resource. I'm just looking online or in the room if there are any other questions. No? No? I teach research at night. I'm used to stares and no questions. So just so you know that. 6 to 9, no one wants to even make eye contact. So, well, in that case, Reggie, and for everyone who, the 30-some people who were online, both here in Pittsburgh or around the country, or in Lucas's case, in Poland, and Lucas, we need to get you to Pittsburgh somehow to do for you to work with us in the School of Social Work, or maybe down to Tulane. I want to thank you for spending your time today talking about this. This topic obviously resonates for me with my research with humans and non-humans, companion animals and pets, around food and actually around disaster management as we try to help people prepare for, I don't deal with large livestock, but with smaller animals. So I just want to end up, just sort of want to end on that this topic just doesn't, it's just not one that impacts humans, right? It impacts non-humans. So so when there's a hurricane and we see these pictures of kittens and cats being rescued, it just reminds us that our climate changes, our disasters impact a lot more than just us. Yeah. So I hope we can continue in the School of Social Work and across the university. If there's anyone from engineering, Mascaro here, anyone from urban planning, any students, to please continue the conversation. I thank you for your time today. I encourage you to please take, as Reggie said, reuse, recycle. So please take food, so we have nothing that's wasted, so please take it home. And Reggie, thank you so much. Again, we will have to get you to Pittsburgh someday,
Definitely.
maybe not in the winter, but, which it is today, but sometimes so that you can spend time with us in person. So thank you very much.
Thank you for the
And-
opportunity, Mary, and thank you, everyone. And just a small takeaway is make sure you have a preparedness plan. I appreciate Mary bringing up that point, and also for your pets. Like you mentioned, Mary. You all might think hurricanes don't impact you, but we saw what happened with Hurricane Ida. How it moved up north and impacted the northeastern parts of Pennsylvania. So yeah, but thank you again, everyone, for the opportunity, and happy Social Work Day.
And